Hello, everyone. I'm Connie Horgan. I'm a professor at the Heller School at Brandeis University, the director of its Institute for Behavioral Health, and co-director of the Schneider Institutes for Health Policy. I would like to acknowledge my colleague, Sharon Reif, also a professor at the Schneider Institutes for Health Policy and deputy director of the Institute for Behavioral Health, who is a presenter with me on the longer version of this paper. I was trained in health services research and was focused squarely on the healthcare delivery system. Early in my career, I became intrigued as to why so little was being done in the behavioral health area compared to the health system more broadly to use health services research. It became my professional passion to use health services research to improve the delivery and quality of alcohol, drug, and mental health services. Given the very high prevalence of alcohol problems in our society, it seemed very strange to me that we weren't using the tools that we had at hand to improve the delivery of services for alcohol problems. I'm very appreciative of NIAAA and the funding that it has devoted to this topic and seeing that we make a difference in the real world of service delivery. I mentioned the word real world, and that is what health services research is all about. It's taking the work that's been done in the lab and in clinical research and making sure that the findings that have been incorporated to work in these settings actually get implemented and incorporated into everyday delivery systems, to the real world of service delivery. So what does that mean? It means you have to look at how people get into care. What is their access? Are they getting treatment or prevention services in the first place? And is what they're getting of high quality? How much does it cost? And what is the outcome? Are things improving as a result of getting services? The overall goal is to support the delivery of high quality care based on evidence. And how do we do it? Health services research is all about studying how we organize, manage, and finance service delivery. This is a conceptual framework of how many people look at health services research. This looks like a busy slide, but I just want to point out the corners of the triangle. Health services research is basically the relationship among three stakeholders: the relationship between the payer, the clinician, and the patient. Things like payer and patient is a medication on a formulary so that the patient can get it paid. Clinician, how is the clinician paid? Are they paid on a fee-for-service basis? So the payer-clinician relationship. And very importantly, is the clinician providing evidence-based services to the client, and how can the system enhance this so that the performance on access, quality, and outcomes is at its peak? That's a simple version, but remember these three players because that's what it's all about in the real world. The next slide emphasizes the span of alcohol services research. It starts with prevention. And what are we doing to raise awareness? Recognition is really a key part of health services research. Is there identification and getting people into treatment? And then treatment takes place. And what are the activities that are associated with effective treatment and how to get it paid and how it can be organized to be delivered in a way that makes a difference in the outcomes? And finally, we can't forget about maintenance because we know that supporting recovery is a long-term issue. So maintenance is a part of this entire framework. All the parts are important. Let's look briefly at some recent imperatives in healthcare and think about how they apply to alcohol services research. There has been a great emphasis in the broader healthcare world on healthcare reform and parity. Parity means, are alcohol, drug, and mental health services treated the same way in terms of financing and delivery as medical services? So how is this done? There's coverage expansion. Reforms have really added many more people to having payment for their health care. And these individuals have disproportionately had substance use problems. So more people have access, new delivery models, and new ways of paying for things. We need to measure what we're providing. And if, as it is measured, we should try to reward the performance, possibly through financial incentives or other means. Information technology is just booming. Greater use of electronic health records leads to many better ways of trying to tinker with the system so that the clinical coordination takes place more often. There are other examples of information technology, digital reminders, but it is changing how we're doing things, and it is helping with the movement towards integrated care. It's the concept of physical health and behavioral health should not be siloed. There's no wrong door to getting into treatment and getting people into the right part of the system that treats people with alcohol issues. There are many innovative interventions that are becoming more widely used. Telehealth has had an explosion, partly driven by the pandemic, but many people think it's here to stay. But how has it affected the quality of service? Let's study it and see if we can make it make a difference in outcomes. Recovery coaches are increasingly part of the delivery system, and medications for alcohol use disorders are now more frequently on formularies and are being used in the system. The next slide talks about how are these things taken down to the level of what research is being funded to look at these issues. This slide is a summary of the health services research objective in the NIAAA strategic plan. It's from the current strategic plan. For alcohol use disorder treatments and recovery models, we need to evaluate the effectiveness of treatment, accessibility. Do people get into treatment, and how can we make it easier for them to actually connect and want to connect? Is it affordable? What is the cost, both to the payer and to the individual who may be paying out of pocket? And what is the appeal? Do people really want to have services? Why is use so low? Another part, an important part of health services research is how do we test these strategies so that we can increase their adoption in real world settings? There's ample research showing that the lab results and the clinical results work. How do they work in the real world? Moving on to some hot topics in alcohol services research, I'd just like to highlight a couple. I've mentioned medications for alcohol treatment. Many have been developed, naltrexone, others, but why is there so little uptake in the real world for them? We've talked about integration of alcohol on mainstream medical treatment. Not everyone needs to be treated in the specialty sector. What can the medical sector, primary care, do to actually engage in treatment? And what can services that can be provided in the community do? The issue of racial equity is enormous. We know that there are great disparities for racial and ethnic groups with respect to access to care, getting into treatment, and the services that are received within treatment. And finally, I'd like to make a comment about value-based purchasing. We're moving away from the old-fashioned model of fee-for-service and paying for services that are bundled together. What does this mean for alcohol services research, and how can we use it to actually improve the bundle of services that are delivered to people? Looking to the future, the key issues in alcohol services research relate to looking at the whole person. We don't just look at a broken arm or the brain or whatever, but we're looking at what is happening to the person overall. There are co-occurring medical conditions, mental health, and other substance use disorders. And looking at the whole person and where alcohol fits in is important. We need to identify opportunities in a less siloed way, greater use of the medical environment and the community settings for providing services or using them as doorways into service. And then finally, we need to be offering services across the full continuum of care, across prevention, identification, treatment, and finally, recovery, and what can help sustain recovery. The last side is a thank you. Thank you for listening to how we can use the tools of health services research to actually improve the actual delivery of care in the real world, how it can be paid for better and organized better. Thank you.